Okay, it's 2:01 and we will start our webinar right now. Hello and welcome to today's webinar on COVID-19 in urban communities, presented by the National Black Leadership Commission on Health, a nonprofit organization in New York City that champions the promotion of health and prevention of diseases to reduce disparities and achieve equity within the Black community. And our co-sponsor, MeAction, which is an international organization building a global movement to fight for recognition, education, and research so that one day all people with myalgic amphibolitis, otherwise known as chronic fatigue syndrome, will have support and access to compassionate and effective care. So I'm Lisa Matthews, and I'm the Director of Programs here at the National Black Leadership Commission on Health, where C. Virginia Fields is the President and CEO. Please note, attendees are currently muted and will stay muted during the webinar. And we'd love to hear from you. So please pose your questions using the chat features, and the speakers will answer at the end of the presentation. So it is with great pleasure that I introduce two speakers today. Our first speaker will be Dr. Dona Kim Murphey, who is a physician scientist and community organizer engaged in COVID-19 education, advocacy, and organizing since February. Her work has focused on the disproportionate impact of COVID-19 on Black and Brown communities and the disabling neurological manifestations of the disease. Ironically, she contracted COVID-19 herself and has become a COVID long hauler. And our next guest, Ms. Chimere Smith, who is a teacher and a writer who has been featured in the Washington Post, Wire UK, and Clear Health Course. Chimere is also a long hauler who suffers from the debilitating effects and symptoms of COVID-19 for over 7 months. So we welcome our speakers today, and I will give the podium to them. Thank you. Dr. Murphey.
Yes, thank you, Lisa, for having us. So I wanted to cover a range of issues since my experience has been both in education and advocacy, as well as in kind of understanding the neuroscientific underpinnings of this disease and the very common neurological manifestations of this disease, which people are sadly still pretty unaware of. The work that I had been doing prior to getting sick was around the disproportionate impact of COVID on communities of color. And just to give people some idea of what that looks like in terms of numbers, recently there were a couple of reports out of APM Research and the COVID-19 I forget the name of the study, but the two groups actually had numbers that they published on the impact on communities of color, and they converged on similar numbers. So if you are Black in America, there have been 1 out of every about 1,000 people who have passed away of COVID. If you're Indigenous, it's 1 in 1,200. If you are a Pacific Islander, it's about 1 in 1,400. If you're Latino, it is 1 in 1,500. And if you are white or Asian American, it's about the same. It's 1 in 2,500. So you can see that the most heavily impacted community are Black Americans, and they are dying at twice the rate of people who are white in this country. And this is not by accident, right? It's not something that is purely the result of this administration's failure to manage this disease, but it is the result really of long-standing disparities in health, disparities in housing, and economic disparities. So really, the Trump administration does not bear full responsibility here, although they could have done a lot better in targeted outreach to these communities, understanding what those disparities were and the vulnerability that those communities had, And there were many physicians who were actually advocating for that kind of targeted approach in access to testing, especially, but also in messaging, in modeling in these communities, the very simple things about mask wearing, about social distancing. And there were no targeted efforts at the federal level, coordinated targeted efforts. So this has been most unfortunate. There's a subset, right, of these communities that is disproportionately represented, unfortunately, in our criminal justice system. And a lot of my advocacy prior to COVID and through COVID has been in those areas as well, both in the prison industrial complex as well as in the immigration detention industrial complex. And we also had significant morbidity and mortality harms basically to the people who were living in those congregant care settings. And this has also been devastating for our communities, for families from these groups. So that's the first thing that I wanted to touch upon. The other thing that I wanted to discuss was a little bit of my personal experience, because I think that it illustrates some of the ways in which the neurological symptoms of this disease can manifest. So I got sick first in March, was basically in bed for 28 days. And that was not because I had particularly severe symptoms for most of that course. They weren't severe. They were multi-system. So I had a little bit of respiratory symptoms. I had a rash. I had GI symptoms. I did have neurological symptoms, and it was in fact those that kept me in bed, because I would have these profound, like sudden episodes of drowsiness, and I wouldn't be able to resist falling asleep. And so, fortunately, I had a job that allowed me to complete my work at whatever hour of the day, and that flexibility really saved me, because I would have to sleep when the urge came on. I was like that for 28 days, and almost, after that four weeks on the mark, I suddenly got better for a few weeks, and I don't know why. And for 3 weeks, I felt like I was in a period of remission where I was nearly my baseline. And then I got a secondary bacterial infection that kind of spread into my eyelid. We were concerned that it was going to involve my vision, because I was having some visual symptoms. I ended up escaping hospitalization. I didn't have to go to the hospital, but was on a very strong antibiotic regimen for about 4 weeks. And then that infection mostly resolved. Certainly the pain went away. I had severe associated pain with that. This put me in about June, July. By the end of July, I had actually a worsening of some of the neurological symptoms that I had. I didn't actually have that same symptom of profound drowsiness, but something that did actually happen in March that I didn't mention was I had difficulty concentrating, particularly like my working memory, like holding multiple tasks in my head or steps of a task. It became challenging for me, and I had to come up with strategies in order to do things that I never had to employ strategies for. They were just very easy to do before. And that worsened at the end of July for a period of about 2 weeks. At the same time, I had actually new onset psychiatric symptoms. So I had like a plummeting of my mood and my outlook on what was happening to me, what was happening in the world around me. And I also had a sudden onset, very strange neurological symptom called alien hand syndrome, where I felt that my left hand was foreign to me almost. And it came on abruptly. It lasted for about a week, and then resolved gradually, but would kind of come up again when I was stressed out or sleep deprived. And that pattern is very typical for small vessel stroke. And so, I ended up seeing a neurologist about that, and they did studies to image my blood vessels. Unfortunately, we have no modalities to image small blood vessels, so the large blood vessels looked fine. And this is actually a common experience. People will go to the doctor, they will have all sorts of diagnostic studies done, and the diagnostic studies will come back negative often. And then your provider, your practitioner, your physician, sometimes we'll question whether, your symptoms are quote unquote real, right? And I think that it's very unfortunate, because many patients feel that their symptoms are not being validated, right? And for me, because I kind of know the neuroscientific underpinnings of this disease, I was able to justify to myself or validate myself, like what I was experiencing. And then I also have this like, privilege of professional courtesy. I can reach out to my colleagues who are physicians and scientists and ask them if they agree with me, with my assessment. And so I get validation that way as well. I felt particularly moved to kind of plug into communities where I felt I could provide some insight to patients who are experiencing especially the brain fog or the other neurological symptoms of the disease, and to at least provide them with some validation of their symptoms. And then also I felt compelled to educate my own peers within the community of neurologists in the United States. So that I've been engaged in since March as well, having webinars and engaging online on social media with my peers, and then also with patients. So yeah, those were, I mean, some of what I wanted to share with you all. I'm trying to see if there's anything that I missed. One thing that I noticed, I didn't mention this, is that when I had my worsening of neuropsychiatric symptoms at the end of July, I plugged into some of these patient-led research communities. They also provide support, and advocacy also is done through these communities. And what I saw is that many people were sharing strategies that they had figured out themselves, and also in conversation with one another about what worked for them, which was really inspiring to me, that people were coming up with, they were ahead of the curve, like the curve in terms of like the scientific community and what we understand of this disease and how to manage it, how to treat the symptoms of it, right? We still don't have anything like a cure for COVID. And I think we're lacking, as patients, we were lacking direction on what to do with our own symptoms. And so we just were talking to one another. And it was amazing, the advice that people had to give. It was converging on some things that many people attested worked for them. One of those things was an anti-inflammatory diet. So this is these are things like salmon, right? So fish oil, what is it, like green leafy vegetables, berries, almonds. These things are very high in anti-inflammatory properties. And, I had always eaten in a fairly healthy way before, but I was never super intentional about making my diet anti-inflammatory. That also means like reducing your sugar intake. And I tend to have a sweet tooth. So I did those things, and pretty immediately I saw an effect for me. And, whereas I think I was at my lowest at the end of July, I was then again, nearly baseline. I would say 90 to 95% my baseline. Since that time, I've kind of hovered there. I've never really improved fully. I still have difficulty with multitasking. And I feel privileged at the end of the day because I can still multitask, but it's not nearly at the level that I was able to do before. And yeah, the other issue that I also forgot to mention was that I had a bit of difficulty with written expression that was very mild in March, but that also was among the things that worsened at the end of July. And I was, substituting words that were not appropriate, but that sounded like the words that I wanted to use. I was often writing in a way that was grammatically incorrect or stylistically, I think not something that I would have done before. And yeah, so that was frustrating, but I think relative to, people who were reporting that they were having such substantial symptomatology, right? In terms of their brain fog, that they were actually having to pull back from their employment. I again felt like I was very privileged in that I didn't have to do that. But I did really grapple with the possibility that this is a disease that is not just an acute infection, right? Obviously, there are many of us. I mean, the estimates are anywhere from maybe a few thousand people in the United States to hundreds of thousands of people. So something like 20% of the people who have been infected with this disease have longer term symptoms, right? So beyond the initial infection, they have a variety of symptoms, including, I think very commonly, neurological symptoms for up to 7, 8, 9 months after infection. So the possibility that this is actually chronic, right? that it's more like HIV, right? Multi-system chronic infection, chronic inflammation. This really was, it was frightening to me. I think the jury is still out in terms of scientifically what we understand of this disease and the possibility that it might be chronic. I don't know. And so for me, that's meant actually therapy. It's required that I really understand about myself what is validating in what I do every day. And, you know, just, I don't know, comfort with who I am outside of what I'm able to produce. And again, I mean, I can't keep coming back to this enough. Like, I do feel a bit that it's kind of like first world problems that I described, right? But you know, I think for each of us, it's different, the way in which these long-term symptoms pop up. And we each are struggling with it in our own way. I think what is really, really wonderful is the fact that we have actually growing communities that offer us support at any level. I think that's how we're going to get through this. And I think also on the research side of it, those communities have been very rich with information and insights on where to go with the research. So that's been really wonderful to be a part of. Yeah, so I think I'll stop there, and you know, at the end I can answer some questions.
Yeah, before we Dr. Murphy, before we go on to Ms. Smith, can you just give a definition of what COVID-19 long hauler is?
Sure. It's basically somebody beyond the initial infection, right? Which is supposed to last like maybe like 7 days to 14 days, something like that. Beyond that period of time, having persistent symptoms. And again, those symptoms can be in multiple domains. And like I said, they're very commonly brain symptoms, or sometimes peripheral nervous system symptoms, like sensory symptoms in your hands and legs. And also with your autonomic system, which is kind of the system that, you know, controls your heart rate and your breathing, things like that. People have also reported a lot of what they call dysautonomia, which is abnormalities in the function of that system as well. So these are the kinds of symptoms that you may see beyond that 14 days. And like I said, it can persist up to many, many months, and it's unclear whether it goes away. And there are some things that we've learned as patients actually help us manage the symptoms or substantially improve the symptoms. And I think Chimere will hopefully share with us some more of what she has found works for her, and maybe what she's found has worked for other people too in her observations in these patient communities. Yep.
Okay, thank you. So Chimere, I'm going to share the screen so that you can start. Okay.
Well, first of all, let me thank everybody. Thank you, Dr. Matthews. Thank you, Dr. Murphy, for sharing. I felt like, honestly, that I was reading my story, listening to my story as you were talking. So thank you so much for sharing your experience.
Okay. All righty. 1 second. All right, share the screen. Here we go. Okay.
Okay. Well, of course, I'm Chimere Smith, and I am a 38-year-old woman from Baltimore, Maryland, and I am a middle school teacher. And I think the theme of my life right now, or for the last almost 8 months, similar to Dr. Murphy, she says she's experienced symptoms and after the acute infection for almost 8 months, is I say that my life is, my slogan for my life right now is to respect the reroute. The reason why I say that is because I am actually living my life trying to figure out how to continue to give my life permission to change. Prior to March 22nd, I was a pretty healthy woman who loved my career. I'm a middle school teacher, so I love middle school kids, and a woman of faith, and a woman who just I was just enjoying my life, prior to March 22nd. And so after March 22nd, of course, everything has changed. But as I mentioned before, I'm learning very much so how to accept my condition, and to accept how my life has changed, and what it will look like as I continue to recover. So on March 22nd, it's so interesting. I put up, as you can see, I put up a picture of my my journal writing. I am my therapist. As Dr. Murphey mentioned, she is seeking therapy, and I've sought therapy for about 2 years. But it's very ironic because the day that I first started having symptoms, I wrote in my journal. It was a perfect Sunday. I wrote in my journal. At the time, I was in a relationship, and we had just come back from the grocery store. I had paid my tithes online, and was really ready to hunker down and get settled into being quarantined and just home, because by that time, a lot of major businesses, including the school system, has said, look, we're going to transition to virtual learning. So my therapist was asking me, she said, well, Chimere, how do you feel about transitioning to virtual learning? And I'll be honest, I was very anxious about what that would look like. I had never taught virtually before. I was concerned about my students. I teach in a urban community, in one of the poorest communities in Baltimore City. And I was worried about my babies. As a matter of fact, a couple of days before March 22nd, I'd actually gone to the school to pick up groceries and other necessities to deliver to the students. That's how much I cared about them and wanted them to be okay, because I understood that this was going to be a huge transition. But in my diary, I wrote, all of these affirming things about what I was going to be able to do and accomplish while we took this time. It was only supposed to be for 2 weeks, while we took this time to virtually learn and transition into a new state of normal. And as I was talking to my therapist, I was like, oh, my throat has a tickle in it, right? And I was just like, well, it was March, so I suspected that it was a sinus infection. I never thought for a minute until that evening that possibly it might have been something that was a little more. And so it started as a tickle in my throat. And then as the day wore on, it became a lot of fatigue, and I just didn't feel right in my body. And so I called my best friend and a couple of other people, and I was like, man, I just don't feel good. And so, everybody was just like, well, you're probably fine. It might be a sinus infection. Don't worry about it. Do you know, allergies or whatever? And so I was just like trying to figure out what was wrong with me. But because I had been so anxious about COVID prior to March 22nd, there was a little still, like a small voice in the back of my head that said, man, you might have this. And I was just like trying to beg off and say, no, I don't have it. Right. But as the week wore on, as you can see, these are the things that I suffered from in March. I was very, very tired. As Dr. Murphey mentioned, I was tired all the time. Everywhere and every time that there was an opportunity for me to rest, I was on the couch. I was on the bed. I even lied down on the floor a couple of times because I just felt like this crushing fatigue that I couldn't explain. If somebody were to ask me then, I still can't tell you, what I really felt like. It almost felt like an alien had started to inhabit my body. And so I was still, with my boyfriend at the time. And we had gone to my doctor, and my doctor was like, oh, you just have a sinus infection, and I was hoping so much that he was right. But then I still was very skeptical. So I went to a urgent care center. And they said the same thing because I have a history of sinus infections. And so I came home that night, and I still just felt so tired and so uncomfortable. And then I started to feel like I had a little bit of a shortness of breath. It was never anything where I felt like I couldn't catch my breath, but it was just something happening in my throat that I just really couldn't explain. And then I found that any little task that I did made me extremely tired. But I couldn't get a test for COVID. And as a matter of fact, when I went to the first emergency room that I went to here, at a local hospital, I was told that I was fine, but I could also hear on the outside of the triage room that the doctors were saying, man, her white blood count is extremely high. And so, you know, as Dr. Murphey will tell you, that that's a sign sometimes of an infection. And at that time, as a pretty healthy woman, I had no awareness of what that meant, but I was soon to find out. And so Wednesday, I went to the hospital. Thursday, I went to the hospital. I was told that Thursday in March that, oh, you just have GI symptoms. Go home. You're fine. And yet it was very odd because every doctor I talked to after my hospital visits would say, go home and quarantine. And I said, why am I quarantining if I don't have this virus, if you won't test me for it? And so nobody could ever give me an answer. Just go home, give it 14 days. You should feel better. And then April came. And in April, I started to, as Dr. Murphey mentioned, experience some of the most frightening neurological symptoms ever. I started to feel like my brain had, if I could describe it, had arthritis in it. You know, it just felt like my head became like a brick. And then it also, the left side of my face started to freeze up and to get very stiff. I couldn't even really move this side of my face, it felt like. And then I started to feel like I had a burning brain, like the around my head. It was like I had a hat on all the time that was laced with fire. And I just knew that that wasn't right. I even thought I was having a stroke. So I went back to the hospital. By that time, it had been my 4th ER visit. And I was tested for a stroke and all these other different syndromes or health conditions. And they were all negative. All of my tests were negative, but I just knew that I did not feel well. And so as time, continued to evolve, at the end of the month, I lost my vision in my left eye. I had televisits with my eye doctors, and they would all say, well, you just, it's just dry eye. And I said, this is not dry eye. Like, I've had dry eyes before. I've had eye issues before. This is very serious. And so finally, when I got to the hospital, 5th or 6th term, I was told, what you have is, Miss Smith at 38 years old, is an advanced cataract. And what we are learning now about COVID is that COVID affects the eye. There have actually been autopsies where they have found COVID in the eye, in the eyeball. And so I suspect, even though there's never been an official diagnosis, that I had my lazy eye, which I've normally had, was produced, and the cataract was produced because of the virus. And so I spent 5 months of my life from April until September with no vision in this left eye. I could not remember sometimes my name. I will wake up and be like, well, where am I? I've been living in the same house for 8-9 years, and I would wake up and I could not remember that I was in my actual room. I couldn't remember people's names. I couldn't recall. I'm an English teacher. I could not recall words or vocabulary or my students' names. When students would text me and ask me, was I okay? Because I had taken off work, I wouldn't know who they were because I could not recall information that prior to March had been so easy for me to interpret and to comprehend. And so I still, I could not do a lot of activities. I stopped being able to lift things. My muscles became very weak in my arms and my legs. And I still had that feeling as if I was like a transformer with my face. I couldn't hardly move my face without feeling like I was in intense pain. But what I started to notice as I went to the doctor and to the hospitals all of these different times, by that time, and in total, I've gone about 13 times, is I was always dismissed. And I was always asked, was I crazy, so to speak? I even had doctors, in the ER department, threaten to escort me to their psychological centers and their psychiatric parts of their hospitals because they were trying to convince me that my blindness, my burning brain, my heart palpitations, my irregular periods didn't mean that I was sick. And what I also started to take notice of is that I can hear. I couldn't see well, but I could hear. And I could also, in my right eye, I could still see what was happening. And I would see different people being ushered into the hospital rooms, because if you're suspected as to be a COVID patient, you are told to, isolate yourself in hospitals. I would notice that non-minority people, I could hear the doctors say, well, we're going to presume them to be positive. And I started to be very concerned about that, because as a Black woman who has tested for this virus 10 times, I've never tested positive, but I kept wondering why these non-minority men were presumed positive while I had to struggle to get even some type of diagnosis about my condition. And so I became very frustrated about that. And as you can see, the symptoms progressed into May. I had a lot of GI symptoms. Now, over the course of 8 months, I've been diagnosed with celiac disease, and I have from March until May, I just experienced some of the worst treatments by doctors, sadly, that I've ever experienced in my life. Prior to March, I'd always, felt as a Black woman that I was privileged to have a good job, good insurance, and good doctors. But after March, I became very disenfranchised with the way that I was treated as a Black woman and as a woman. But June came, and as you can see, as Dr. Murphey highlighted, here are some of the most recent statistics about African Americans and the death rate. 1 in 920 Black people die versus 1 in 1840 of white people who die. And so I started to think about that as a woman, as a Black woman, listening to my friends' stories who have told me over the years about all the times they have gone to doctors historically and they have not been believed. And so in desperation, because by that time, I had started to contemplate suicide, because I said to myself, I cannot live this way in this body with this brain. And so I started to do some research out of desperation, because a lot of times I couldn't even get out of my bed, but I could use my phone. And so I started to research about the number of Black people who have been infected by this virus, and how many of us had died by it. I started to look up articles about Black women in prior situations who had not been believed about having different health conditions. And I started to feel something inside of me, as weak as I was, start to want something to change for me. And so I started to reach out to those hospitals and those patient relations teams and ask them about being seen again, and to be consulted about my condition, because I knew that I had this virus. And by that time I learned about, the term long hauler and long COVID. And I thought to myself, ding, 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 that's me. And so I started to be a part of social support groups that focused on this virus, and how, a few of us have not healed past the 7 to 14 days. And I started to use Twitter and my social media, handles to really dig into what was happening. And what I was more concerned with after June, as I was trying to save my life and get somebody to listen to me, I started to wonder, why am I not hearing more stories about Black people, Black women specifically, and their journeys with long COVID? When I would look at CNN, which I've become obsessed with, I would always see stories of, a lot of white women. They would tell their stories. And I say, well, here I am, a Black woman, in America. This is affecting minority people more. And yet I don't see us on these screens. And so I started to really try to figure out how I could advocate for myself. So all of my advocacy and activism, and as small as it is right now, it was born because I was trying to save my own life. And in the process of saving my own life, I thought, what about my sisters? What about my brothers? What about other minority people who may be experiencing some of the mistreatment and the ailments that came with this virus? And so I started to, Google, write Google reviews for doctors. I started to actually think about the doctors that I had And sometimes, as we've said, as long haulers, we have to fire our doctors. I became very active in COVID support groups. I even hired a patient advocate. And I know that that's not always something that people can do, but I was so desperate that I wanted to hire somebody to help me navigate the medical system. And then I started to be very transparent with my family, my friends, and my social media community, because as a Black woman for 5 months prior to becoming so transparent, I was so filled with shame. I said, I've never been this sick. I've had an image of myself as a Black woman. I've been strong. I've been powerful. I'm smart. I go hard for my kids and my students. And here I am, sick as I've ever been. And I felt shame. And so it started to make me think about some of the psychological repercussions that this virus can cause, because I thought about other Black people too, who probably felt the same way I felt, but they did not feel comfortable sharing because they may not know that they have long COVID, or they just might feel ashamed. And so I started to literally use my Twitter fingers to get the ball rolling on people starting to pay attention to how this virus affects Black people, Black women, and other people of color. And so I've been thinking very long and hard as I've tried to reach out to my local hospitals, and I've seen such a disproportionate amount of minorities really speaking boldly or given the permission and the access to speak about what we need. And I started to think about the fact that we need doctors with long COVID experience. I don't want to talk to a doctor who does not know what this looks like. I know it's still very new, but I also need a doctor that's going to be very caring and at least can listen to my symptoms to help guide, me and us in the right direction. We need to have more Black media to focus on our stories. I've tried very hard to reach out to Black media to get them to tell more of our stories, because we need to be heard. We need to be paid attention to, and we need to be a very vital part of research and treatment opportunities. I'm trying to get into a study with the NIH about studying my neurological symptoms, because even 8 months later, they still rear their ugly head. I still get brain fog. I still get very dizzy. And I've also developed trigeminal and occipital neuralgia, which is an inflammation of nerves in the brain and in the face. And so there are so many different things that urban communities need. Here in Baltimore, what we need, and New York City, and places in LA, and all of the places where urban communities are populated, we need a governmental stakes in what we need in our healthcare. We need government to step up and say, listen, we have to inform people of color what long COVID looks like. I don't see any I don't hear any radio ads or any advertisements or any banners anywhere on billboards that specifically speak to the people who are struggling with this virus the most. And so government has to take a better stand in that. And then we also need to share our own stories. And I know how difficult that is, but I've always been taught that I've learned better by word of mouth sometimes. And so it's like we have to start playing the game of telephone, because when we play that game with each other in the Black community and other minorities, we can tell each other, well, look, I was sick for this long. This is what happened to me. This is what I experienced. And I know as a people, we learn better by word of mouth. And so we have to get very rigorous and diligent about speaking out, because when I spoke out and when I became transparent with my community of people, mostly Black people, I had plenty of people, and I still have people coming to me, in DMs and messages saying, oh my goodness, Chimere, I've experienced the same thing. And so there's power in sharing. And we also need the financial and the psychological tools for wellness, because this virus definitely plays on our minds. I wanted to commit suicide for 2 months in a row. And that was the most devastating time in my life. I wanted to end it, because I could not couldn't fathom life on the other side of not being able to leave my bed, and a brain that felt like it was on fire. And so we need resources, financial and psychological resources that cater to us being able, as minority peoples, us being able to take off of work if we have long COVID, us being able to be paid, us being able to access health care. And those are things I've been struggling with since March. And so what's happening with me now is, while I feel about 70% better, I'm still not at my baseline. And so since September, I've had cataract surgery. And I have, as Dr. Murphey said, I've had to implore the help of my faith leaders. My godmom is a pastor. So every other day I'm talking to her about faith and my crazy faith, because I do believe, as a woman who grew up in church all my life, that God can completely heal me. And so, but I also know that therapy has also been a saving grace, because I get to express what's happening to me, how it's affecting my mind, accepting that this is my reality right now. I've also started to invest in something called Craniosacral Therapy, where an energy healer starts to connect with my nerves and my body, so that she can connect with the nerves in the back of my neck and my brain, so that I get a little bit of relief from the pain I feel on a daily basis. I've also started taking a medication that helps with chronic illness and chronic trigeminal neuralgia. I don't know if I'll have this for the rest of my life. I pray to God that I don't. But this is very real. And if we do not talk about it, then we are destined to have more of us lose our lives in our communities. And we cannot afford to take that risk going forward. And the last thing I'm doing is I'm doing something called ozone therapy, where my blood is being oxygenated so that it can kill some of the pathogens and bacteria and viruses in my body. Now, we know that there's no cure, but I do believe that God created opportunities and doctors and specialists to aid us in the recovery process. So those are some of the things that I'm doing, but it is still a long journey. I'm still not working. I'm still not receiving financial help. I have not received a paycheck since, a check since June. And as you can see now, I've developed a droopy eye because I have what you call cephalgia, which is a cluster migraine syndrome. And so I'm on a few medications trying to combat those symptoms. And so it's been a daunting task, but I do believe that it is a part of my mission to make people aware of the symptoms of this virus, and to let Black people know, and people of color, what it looks like, so that we won't miss the mark in seeing it, so that we can start to prevent this, and that we can start to be a part of the treatment. I do not want Black people or minority people to be excluded from these research conversations. So I'm thankful to be able to speak. And then I also included some resources for people who may be struggling with long COVID or COVID in general, for people to look up. These are some of the groups that have helped to really save my life. Had I not joined these groups, I would not know about long COVID. And I don't know, outside of my faith, if I would be here today.
Wow. Thank you so much for sharing that powerful story.
Thank you.
We have some questions in the chat that I'm going to pose. And everyone, please pose your questions using the chat feature. All right, I'm actually seeing resources here. Well, one of the questions I want to ask is, and either one of you can take this, is that we've been hearing a lot lately about these persistent symptoms. Both of your stories, it was actually also I think featured on Dr. Oz last week. He talked about it. Is this considered or I guess formally recognized in the medical community, long-term COVID? The last thing I heard, it was not really recognized. Is it recognized in the medical community?
I guess I can take that first. Yeah, there's a growing literature on it. I think increasingly physicians are understanding that this is not just an acute infection, but might be chronic, as I mentioned. I think it is important, as Chimere mentioned, for patients who are suffering from these symptoms that are longer term, to be more visible as much as that's possible. I always am cautious about pushing people into this kind of advocacy work, because there are real implications. I understand that, especially when you are being very transparent about cognitive symptoms and what that might mean for your work, right? So I totally sympathize, empathize there. But it's really important where you feel like you're in a position to be candid about the symptoms that you are grappling with. People need to know that this is very real for a large number of people, and specifically for communities of color, because we have been historically under-resourced in healthcare. And Chimere is absolutely correct when she says that that the medical establishment has not only failed to believe patients from communities of color, but they have historically exploited patients from communities of color. So there is a lot of historic distrust there. And I think it is incumbent upon those of us who can be more out and loud about what we're facing, to be out there and do some advocacy around this, because otherwise we're not going to get the resources that we need. And I think physicians, even as they come to understand long COVID as a phenomenon, unless we're very clear the ways in which, again, communities of color are disproportionately impacted, right, in the ways that Chimere described, they will not focus their attention on that problem. And they need to. Because otherwise we're going to perpetuate these historic harms.
Thank you, Dr. Murphy. I think, Chimere, this question is for you. What makes you feel safe and supported in a research setting?
In a research setting?
Yeah. I think you mentioned earlier in your talk about,
you know what? I wouldn't necessarily say it's safety, but what I care more about is finding out, being a part of the research that speaks to other Black women who have experienced what I've experienced. I would rather somebody take a look at what's happening in my brain, on my brain, than sit home and not be able to say that perhaps what I've done has impacted myself and impacted maybe another woman who has experienced some of these neurological symptoms. And so while I worry every day, I suffer with anxiety like a lot of long haulers, I am more interested in what will happen if, as a Black woman, I'm studied on long term. And so I care about the results of that. And I'm willing to sacrifice my time and, I guess on some levels, my safety for that.
Okay, thank you. So this question, or comment and question, there's a possibility that 10 to 20% of people will go on to have chronic fatigue syndrome. I would say the experiences that are being described are more like chronic fatigue syndrome than HIV. Have your medical providers talked with you about the possibility of having chronic fatigue syndrome? I ask because Dr. Tony Fauci is bringing this up in some of his talks. So either.
Yeah, actually, the last time I saw my new primary care physician, we talked about that. And it's very interesting because I've started to do a lot more research about chronic fatigue syndrome, because I'm dealing with still the fatigue and the malaise, which is after I do anything, sometimes I feel extremely sick, nauseous, and very weak in my limbs. And so you know, he talked about that being a possibility. And sadly, there is not a large medical community of doctors and healthcare providers that are knowledgeable about chronic fatigue syndrome. So that's another worry that I have. But I've started to do something called pacing, which as a Black woman, that's difficult for me. You know, historically, Black women, we just push through, we power through. And a lot of women of color too, because, you know, there are not a lot of resources for us. We don't make the same amount of money. We have to work a little bit more. And so I am pacing myself, and I'm also actually working on a small ebook where I'm instructing Black women on how to pace as I learn myself. So it's a very real possibility. It's the one that makes me very sad, but it's a very real one.
I wanted to add here, so the reason I bring up HIV as possibly a model by which we can examine this, you know, or a lens through which we can examine what we're experiencing now as long COVID or long haulers, is there are a couple of things. I mean, there was a lot of uncertainty historically around HIV as we were learning more about it in real time, right? So that's very, very similar to what's happening now with long COVID and our understanding of this as a chronic ailment. The other thing is actually pathophysiologically. So what is actually happening in your body? Certainly a lot of the effects that we've described here today, most of them, I think, are probably the result of chronic inflammatory response, like just an over-exuberant response of our bodies to the virus, having been infected by the virus. But the other thing that is actually true in some preliminary research, particularly in the brain, is that the brain cells are infected by the virus and they don't see a lot of inflammatory infiltrate, actually. So there is actually something that's specific to multi-organ infection by the virus itself and not just the inflammatory response as a result. So it's probably both things that are happening, just to let people know. And the other thing I wanted to say about CFS, about chronic fatigue syndrome, is this is a diagnosis that is disproportionately given to women, like two to four times the number of women than there are men, right, who have that diagnosis. And again, the medical establishment was kind of built around the model patient being a white male. So I do feel like women and our symptomatology tends to get erased. I mean, historically, some of the symptoms that we would experience were called hysteria, like in the 19th century. I think it's similar now where there is uncertainty. They tend to not believe women and women of color. And they tend to believe the model patients in the Western medical establishment.
Thank you. Thank you. With regards to COVID, are there any policies being put in place to address the needs that both of you discussed? Any policies in place?
I know that there has been, and I'll use one of the groups that I'm a member of, you know, Body Politic, via a social media platform called Slack. I know that they are really, really going hard to try to get research done via surveys, and also get people of color to participate, namely Black people, so that they can go to the table of government official and healthcare officials to really be very transparent about what's happening to long COVID sufferers. And so while I'm not aware of any policies yet, I'm very encouraged to know that, as Dr. Murphey mentioned a while ago, that these COVID patient-led research teams are coming together to really create surveys that are accessible to everybody, so that we can get more research off the ground, so that we can speak to government and get some things rolling. Because one of our major concerns, you know, is our inability to have health care in the next year, because, you know, there's some suspicion that COVID or having long COVID will become a pre-existing condition. So we definitely need some policymakers who step up and stand out for us.
Yes, thank you. I remember as I mentioned about Dr. Ozone, he was talking about, you know, COVID long haulers, and one of the speakers on his show was saying that, you know, we run the risk as a world to see the largest amount of young people with chronic illness as a result of COVID long haulers. And I just wanted to hear your take on that. I thought that was just really profound hearing that. You know, we think of chronic illness in older people, but just the idea of having younger people diagnosed with this and becoming like long-term, having chronic illness over the long run.
Yeah, the research is very preliminary, and this is why we have mentioned, I think, multiple times in this webinar, it's really important, as much as you feel comfortable, to join these communities and to participate in the research, particularly if you're from communities of color. But it does appear that the people who are exhibiting symptoms of long COVID are skewing younger. And they are skewing a little bit more female too. And, you know, at the moment, we don't know for sure if that's just an artifact of the people we've reached through our social networking and social media outreach, or if that's a real thing. The other thing that we're seeing that we don't believe is that this appears to be disproportionately white. We don't believe that. I think it's just a matter of not having reached the people yet to engage in the surveys that are providing the data, that are informing, you know, what we understand about this disease. And this is why it's so crucial, because we can't, if we misunderstand the disease because of, you know, incorrect data, that is what will then go on to inform the resources that we get for our communities. And again, this will perpetuate historic wrongs that are racialized, right? So we really, really need folks from communities of color to participate for that reason.
Yes, and you mentioned that it's also the messaging, right, that we're seeing, like you're saying, the messaging that's going out there. So you're thinking that it's not affecting Black and brown communities as much, as more skewed on the white population. And that's it's important that that message gets out. And that's why we're giving webinars like this, to put the message out to the larger community, to say, hey, you know, this is disproportionately affecting Black and brown communities. And
and I'm so proud of National Black Health for doing this, because we need this information out, you know, and as Donna said, you know, I do not, you know, want to push anybody to share before it's their time to share, or to force anybody to share. But as I keep saying on Twitter, which seems to have one of the largest communities of long, you know, COVID sufferers, we cannot afford, minority people cannot afford to not be a part of the research or treatment opportunities. We have to have a seat at the table. If we don't, it'll be the repeatance of the same historical mismanagement and misinformation in healthcare and health conditions that we've had since this country was created and derived. So I am hoping that just webinars like this will reverberate around the world, so that people can see what this actually looks like. These are real people of color who've experienced these debilitating, you know, conditions and symptoms.
Thank you. Thank you. So we're about close to 1 minute left. And I just really want to thank both of you for your bravery, your transparency, and taking the time out of your day to share this information with everyone and bringing attention, the so needed attention, to COVID-19 and long haulers syndrome. So I thank you. You know, everyone, we will be sharing a survey, and I ask that you please complete the survey at the end of this webinar. And there's some resources that Chimere shared, as well as you can also obtain more information about COVID long haulers at meaction.net. You know, so those are resources you can go to, and I guess I can share your slides, Chimere.
Absolutely, please do.
Okay, with everyone. And again, thank you to both of you, and thank you everyone for taking the time out to come out and hear. You know, the National Black Leadership Commission on Health will continue to shed light on this. We will have future webinars about COVID-19. So we will be sharing this information. So look out for it on our website, www.nblch.org. And again, thank you everyone, and have a great rest of the day.
Thank you. Appreciate you, Dr. Matthews.
Bye-bye.
See you, Dr. Murphy.
Bye.